In this video we will talk about prevention of typhoid fever. So typhoid fever is prevented by vaccination and food and water safety, so only vaccination is not enough to provide coverage and prolong immunity against typhoid. So food and water safety is also very important and plays a greater role in the prevention of typhoid fever. So what are the types of typhoid vaccine? So typhoid vaccine have two types. One is inactivated vaccine and the other is live attenuated vaccine. So inactivated vaccine is administered as an injection, shot. It may be given to people 2 years and older. One dose is recommended at least 2 weeks before travel. Repeated doses are recommended every 2 years for people who remain at risk. While it is an attenuated vaccine that is live but weakened, and it is present in a capsule containing vaccine. 4 doses of one capsule given 48 hourly 10 days before travel. Live typhoid vaccine is administered orally, by mouth. It may be given to people 6 years and older. A booster vaccine is needed every 5 years for people who remain at risk. So this was all about today's topic. For more informative videos, please subscribe to our channel and press the bell button. Thank you.